HIV has been with us for quite some time, more than 40 years with tremendous gains and losses. On this week's episode of Health Watch, we look at our HIV status as a country. Where are we? 1.5 million people in the country are estimated to be HIV positive, out of which 139 of them are children aged between 0 to 14 years. To further reduce this HIV burden, Kenya has embarked on a campaign dubbed U equals to U, meaning that if one has the virus, it should be undetectable and therefore unable to be transmitted from one person to the next.
People living with HIV who adhere to the antiretroviral medication as prescribed by their healthcare providers can achieve a durable and detectable viral load and do not transmit the virus to their sexual partners. 90 to 92% of our transmissions in the country are sexually. That's meaning that for clients who is HIV positive and they are not virally suppressed and they are with sexual encounters, then they can be able to transmit the virus to their partners.
Although awareness of HIV and AIDS is high in Kenya, many people living with HIV face high levels of stigma and discrimination, which prevents people from accessing HIV services.
Mambo ya stigma nilete shida zaidi. Vile tu nilizungumza hapa mwanzo kabisa. Bibi akanitoroka. Alafu baadaye kwenda kujua ama kuona kwamba nimerudisha uhai bado naendelea kupumua, akarudi tena. There
are two stigma, but sometimes they go hand in hand. Self-stigma and external stigma. So self-stigma is about yourself. How do you perceive yourself as someone living with HIV? Do you perceive yourself competitively? Do you perceive yourself to do your daily routines? And I think it's a journey that as much as we look at the external stigma, but we need to start with the internal stigma, your own acceptance. Jijue kwanza, na ujikubali. Once you've accepted yourself, then you'll realize you'll be moving on.
A vaccine has been seen as a potential solution, but the search for one has been unsuccessful, and scientists are now back to the drawing board. A vaccine made by Johnson & Johnson offered no convincing protection against HIV infection in the clinical trials that involved more than 2,600 young women in Africa. When it comes to HIV, prevention is key, and this includes testing, voluntary medical male circumcision, access to condoms, and access to pre-exposure prophylaxis for those at higher risk of HIV infection. An early start of antiretroviral therapy for those infected is another strategy the country is using as a preventive measure. Kenya launched a 95-95-95 HIV strategy, meaning 95% of people living with HIV should know their HIV status. 95% of people who know their status should be on treatment, and 95% of people on treatment should be virally suppressed. The first two 95s are recording progress, but the challenge has been in getting everyone on treatment and to maintain viral suppression. The biggest challenge has been in people adhering to taking their antiretroviral drug regimen. Many people don't know that when one is virally suppressed, there is minimal risk of transmission of the virus to someone else, especially considering that 90% of HIV infections in the country are through sexual intercourse.
We want to reduce new HIV infections by 75%. We also want to cut down the AIDS-related mortality cases by 50% by 2025, as well as reduce stigma and discrimination. Stigma and discrimination is a very important aspect of this campaign. It is because of stigma that today we estimate, when we do surveillance, when we look at program data, we estimate that we have around 1.5 million people living with HIV, yet only 1.2 million are on treatment. There are possibly an estimated 300,000 people who remain either undiagnosed or are not currently within our treatment programs. And for this matter, this U equals U campaign provides another momentum for us to ensure that ending AIDS as a public health threat becomes a reality to this country.
Poor adherence to antiretroviral treatment complicates suppression of the virus due to increased drug resistance. Unfortunately, Kenya does not routinely do drug resistance monitoring tests, and therefore assessing levels of drug resistance in the country is difficult.
We had reduced the transmission rates to almost 8.5%. Our goal is to drive towards our less than 5% transmission rates. But currently, what we have seen in the last 2 years is that we have not done well as what we would have expected to have done by now. It was envisioned that by the end of 2020, we'll have eliminated new infections transmitting from mothers to their children. But in fact, what happened is that we've seen an increase, and we are currently at around 9%, which is still way above our target.
People living with HIV and also have comorbidities have been urged to embrace COVID-19 vaccination as they risk getting severe COVID-19 if not vaccinated. So far, new HIV infections have declined from 75,000 infections in 2010 to 41,416 infections in 2019. The rate of HIV infections in the country stands at 4.5%, even though counties like Homa Bay have a high infection rate of 20.1%.
There are several gaps, and one of the gaps is diagnosis. And diagnosis of HIV, meaning early diagnosis. We have quite a large number of people living with HIV who do not know their HIV status. And again, for those we diagnose, we also have a group that then is left behind, although it is not quite as large as the one we put on treatment. That group becomes very significant. And again, of those who put on treatment, we have those who do not adhere to the medication, and then we do not have 100% viral suppression. So what does this mean? It means from the people who we've not diagnosed to those who we have diagnosed and they are put on treatment, and to those proportion that on treatment are not viral suppressed, that group then cannot achieve what you're talking about, undetectable, untransmissible. And that is where the challenge lies. And when you look at our data, as Momanyi comes to give us where we are with 95 currently, you'll find that we have subpopulations that don't do well. A young person just told you that one of subpopulation is adolescents and young people. Then we also have our outcomes for children also not doing very well. You get, like, for example, 64% of our children being on treatment, and therefore you have a total of 36% that are out there. We need to find them, and we need to put on treatment. The other subpopulation that have challenges, which were mentioned here, are men. And men play a very critical role in ending this epidemic. One, because we have an epidemic that is both concentrated, but in some places generalized. Other places we have a mixture of where it's just one population that has many people infecting one another, or one population passing to the whole general population. So as such, men play a critical role. One is that because science, again, has taught us that with what we are looking at, what we call phylogenetics, that if we do not target men, we then do not get men to get diagnosed, we don't get men to get treatment, and they don't get viral suppression. Our transmission rates increase by almost 5-fold. This is because it has been shown that by putting men on treatment and targeting that interruption of transmission, you actually can reduce transmission rates in a community where the epidemic is generalized, such as ours.
As the quest for a vaccine continues, Kenya's journey to ensure uninterrupted supply of HIV medicines has been bumpy. Local manufacturing was suggested to be the better way of ensuring access to these drugs and to stop overdependence on donations.
These drugs are manufactured, but also manufactured under very stringent rules of the World Health Organization, and therefore any process or decision to manufacture locally has to follow all the rules that are stipulated therein. Currently, we have one private sector partner who is getting or gotten the approvals by the World Health Organization to locally manufacture ARVs. And for that to also benefit the entire program, it means that as a country, we have to also commit to support through what we call contract manufacturing, or buying from those who are manufacturing, and ensuring that we also provide the conducive environment for manufacturing locally. Local manufacturing also promotes not only the industries, but also it's a way of creation of employment of opportunities for our young people.
Despite the challenges, a few milestones in HIV research in the world have been made in regards to treatment and management. Some of the new trends is in the use of dapivirine vaginal ring to reduce the risk of HIV infection, and monthly or 3-monthly antiretroviral injections. However, this mode of HIV management may take years before they get to Kenya.
We know that the dapivirine ring has actually been approved by WHO as one of the ways of preventing acquisition of HIV amongst women who are at the highest risk of getting HIV infection. So it's one of the interventions that we are actually going to adopt in our revised guidelines. So it's going to be there. But of course, just like any other new form of intervention, we usually do what we call feasibility and acceptability studies in our population, just to see, is it acceptable? Are they having any issues that we need to address before we roll out to the entire population? So we are going to ensure that it will be rolled in the country in a phased approach. Once we have information about how acceptable is it, do they prefer the one that stays for 1 month, or is it the one for 3 months? And what are some of the issues that they have, so that we address this, so that even as we scale it up to the rest of the country, then it's available. In relation to the injectable, yes, I'm sure you have all seen some of the research, and science has shown that there are now effective treatment that can be offered as a long injectable that can be given over a long period of time. This is not yet available in the country. But as a Ministry of Health, we are still just looking at the science, looking at the availability. And even when it's available, remember there are other issues that need to be considered, including the cost of this medication in terms of, remember that even some of these medications, once they're licensed, they still have to, what we call, they have to open the patent so that we can have the generics that then we can be able to afford as a country for our population.
Kenya targets to end HIV and AIDS by the year 2030. This means that by 2030, there should be no new infections of HIV by eliminating mother-to-child transmission and sexually transmitted HIV by ensuring that those living positively have significant viral suppression. To end HIV by 2030, those on antiretrovirals need to adhere on their drugs to avoid new infections. Building Waliaula KTN News.